It's a joy for me to bring to you truly one of the great plastic surgeons of the world, Ivo Pitanguy. Ivo, it's a joy to have you here with us.
It's a great pleasure, and a great honor to have you.
Well, you're doing us an honor to have you here.
You are always.
We want to talk to you about your career. Where are you from originally? You're Brasileiro, but where were you from originally?
Well, very much Mineiro. I was born in Minas Gerais. It's a beautiful area of Brazil. The town, my father was a doctor, a general surgeon, my mother a great humanist, and we were raised in a very the atmosphere of values. It was much more spiritual than, I would say, economics. Our spiritual values were very predominant at that time. And my father and my mother, they were always interested in what I would do, what I would like to do. They never induced me to do medicine. But I felt a strange desire to go in medicine. And I started Belo Horizonte. Then I moved to Rio during the end of the war. We were supposed to do CROP, kind of, I had flat feet, so they put me on a horse. And I had to put medicine and my training as a reserve lieutenant together. But it was very interesting, a lot of work. I made a kind of competitive examination in Rio to be an intern here. And then I stayed here. From here I made another one in America to the National Society. There was in America, international, great thing America had been doing for education. And I was in one Institute of International Education. And I won a scholarship. They were not for medicine, it was for everything. I have the cello fellow with me, the other businessman. But I knew some English. Because in Belo Horizonte I studied English with Miss Frida. She was an English lady that lived by there. And so it made it easier to me by knowing language. And I went to very depths of America, to Cincinnati, Ohio.
Tell me about your father. What kind of work did your father do?
My father at that time, general surgery, would do almost everything on the abdomen. Even fractures they would do.
Yes,
so that time
he was truly a general surgeon.
Everything that would come.
I heard you tell a story once about your first view of the ocean and how you were just captivated by it when you came from Belo Horizonte to the ocean.
When I came?
Yeah. When you saw the Atlantic Ocean, you thought it was fantastic.
Well, when I have never seen the sea in my life. Belo Horizonte is on the mountains. And the first time I came to Rio and I saw the ocean, I realized there was a new world sharing me, facing the quality of giving to my father to us, challenging. And I felt that thing, that I had no word to describe it, and I looked like a stupefied. And from there on, that breeze that comes from the sea still enchants me. To Rio is a very magic city. It was my second home, but it's the home that I loved and that I stayed. And probably I'm going to die around here. I don't know when, but I have no plans.
Those of us who know you well fully appreciate the fact that you are what we call a Renaissance man. I've been in your home and I've seen beautiful paintings from all over the world. I know that your knowledge of poetry is extensive. What brought you into the pursuit of Renaissance type knowledge?
Well, I feel you are all a little bit of product of your own environment too. And at that time, my mother, she was always reading a book, my father another book. And we live in a small town. We are introduced to the world, to Flores, to the books of Anatole France. We are introduced to the other areas of the world, to Paris, to Marot. So many, we travel a lot in our book, in our imagination. She came from a town, my mother called Diamantina. That's a small town where the first Monday resident was searching for gold came, and they found diamonds. But diamonds have a magic, and that diamonds, they said, people would walk cultivated to take care of diamonds because it could be stolen easily. And so they followed the death of the diamond romantically.
Yes.
Where at that time, America was starting its influence in the world as a great cultural influence.
Yes.
French. So we were very much formed in the French culture. even the medical books and everything, they were free.
Yes. Tell me about your career. You began here, and I know that you were involved in a terrible fire here in the city. Tell me about that.
Well, that came sometime afterwards.
Mm-hmm.
I started here. I spent about 2 years with Longacre in Cincinnati. And he was coming from the war with Gillies at that time.
Mm-hmm.
I was very much introduced to reconstructive surgery, the general reconstructive, no aesthetic, mostly reconstructive. Then I came from there, I went to France. I spent about a year and a half. And then I went to England with Sir Harold Gillies and McIndoe. But when I came back to Brazil, I really, by traveling, I had acquired a lot of knowledge at that time, but I realized what a difficult I had to acquire it. And I thought it was my responsibility, my deep responsibility, to share it with the others. So I created, at that time it was an open medical examination. See, they had also medical examination, and one infirmary at the General Hospital.
Mm-hmm.
And the infirmary, I made it of no distinction between plastic and reconstructive.
Yes.
I called plastic aesthetic surgery. And that it meant because I was trying first to the medical group to explain to them what was plastic surgery. But there was a knowledge of an orthopedic, I should put it flat. There was all the basic things that today they would think they were at the time. But at the same time, to put aesthetic surgery, a pure condemned vanity. So at the moment, just to finish, that I put it in the General Hospital, I tried to take it from the elite side.
Yes.
To show that they're suffering. You don't judge it by what you see, but what it causes to the other.
Ivo, tell us about regrets. Do you have any regrets in your practice?
Well, if I look back very carefully, I always thought that I operated someone by lack of experience. And there was more than somatic. It was more a psychological implication. And when we start, we want to help every patient. And sometimes the best help is not to operate.
That's right.
So I may have some regrets of 1 or 2 patients that I have operated I shouldn't not.
Yes, I
And I'm
understand.
very careful of that. Because, but I have, regarding what I've done, I have no regrets. I have just satisfaction.
You know, in this regard, I've always, for a long time I've said, if the patients, our expectations are such that we can't achieve what the patient is seeking, we should not operate.
Absolutely.
So we
But
have
it's one thing.
we have to communicate with the patient to find out what the expectations are.
You have to have the communicate, and it's very important with interaction. And modern doctors, they have less contact with patients. They
Yes.
want techniques, and that's a big mistake. One of the great methods that I think is before being plastic surgeons, we are doctors. Then we are surgeons. And then when being a doctor, a patient comes to you, you can be positive or negative, iatrus, the god of medicine. You can be iatrogenic, positive or negative. He comes to your advice. It's up to you to say to operate or not to operate. So we can make mistakes, but we should be aware of that.
We're we're artists. We're plastic surgeons, meaning to change or mold or make new. But we're surgeons. We move tissue around. But we're physicians. And a physician's job is what? To make patients' lives longer or better or both.
Yes, they're both.
So if what we do does not make their life longer or better
No,
or both, then we...
When I look at my statistics, facelifting, I look at a lot of people are living longer.
Yes,
Their problem, their job.
yes,
And by living longer, the station of gravity that they haven't stopped yet
yes,
makes them look not so well to themselves.
yes,
Their own appearance. And many times older people that before were called older, in my curve, I have a normal increase in people more than 60 years of
Yes.
age that want to operate, when before it was 45, 50.
yeah, yeah.
So I feel to be well and in peace with yourself, one of these parts is to like the way you are. Of course, you have all the prerogatives of the biotype, we cannot be aggressive. But we have to live in the best way what we are.
Yes. What do you tell young plastic surgeons, the most important thing you can tell them? A young plastic surgeon comes to you and says, Dr. Pitanguy, tell me the most important thing that I must know in my pursuit of my career. What do you tell them?
Listen to the patient.
Listen to the patient.
And see if you can do.
Yeah.
Try to make them comprehend your limitations.
Yeah. What about all the new things that are coming along? Do you see anything new in plastic surgery that's exciting to you?
They are very exciting but very dangerous. And I have a lot of residents that many times after a meeting, they suggest this, that, and that. That's why we try to make our formation most of the basic principles that have been proved after you have done the basic abdominoplasty, the basic circumferential set of breast, face. You can go to the variation. But you should know well the body.
That's right.
Before you go to variation.
That's right.
And I think one of the things, when we talk about aging phase, there's a lot of overdoing of this.
Yes, overdoing.
When people want to look better and not to, like your fellow that you say, take me off now.
Yeah. you remember that? That's from 1970.
And I said, take me off.
That's right. I'm glad you remembered that.
Make a breaking decision.
Well, my dear friends, this is Ivo Pitanguy from Rio de Janeiro. I have to tell you a little personal item here, that I came to visit him in 1972, and I was just in practice a few years and was certainly nobody of any consequence. And Ivo Pitanguy treated me like I was very important.
But you are not important, you were.
Well, maybe I was or maybe I wasn't, but I didn't think I was, and you treated me like I was, and ever since that time, when I've had a visitor who's come to see me, I've thought about you and how you treated me, and I've tried to treat that person with the elegance and the respect that you treated me.
I know we all be Christians.
So thank you very much.